have recorded a 30% increase in cases of violence since the beginning of the pandemic. Worse still, and this really is a shocking statistic, close to 5,000 rape survivors have received medical treatment in health facilities during this period of the pandemic. Children below 18 years bear the greatest burden, as they comprise of 70% of these survivors, with 5% of these survivors being male. Ladies and gentlemen, some people say the measures that we have put in place for the purposes of curtailing the spread of coronavirus disease may have contributed to the aggravation of this violence. And it is important that we point out that these measures do not at all justify any violence being meted out on innocent members of our society, more so women and children. Measures such as movement restrictions, which have been in place and have since been lifted, the disruption of social networks, the loss of income, were all meant to address the COVID-19 pandemic and not intended to trigger or indeed become an excuse for any form of violence. Unemployment, the inability to provide for families, the economic uncertainty that we are facing may have added extra strain and heightened anxieties amongst families. However, again, we do repeat that this is not an excuse to meet any form of violence. And it is in this consideration, in terms of the issues that we've laid out, that we have instituted a raft of measures to mitigate against social upheavals and to continue to encourage members of the public to ensure that they take advantage of these measures to cushion themselves. We are concerned with this violence because of its devastating consequences, such as the serious physical, mental, sexual, and reproductive health problems that are often associated with such violence, in particular, sexually transmitted infections. And remember, I just mentioned 5,000 recoveries just in the past few months in terms of rape, HIV, unplanned pregnancies, all ill side effects of this violence. And so we do continue to urge members of public to again be each brother's keeper, to ensure that we are working together, protecting each other, protecting our children, protecting our women and our men in the society. Of particular interest and note is that the National Prevention and Response Plan on Violence Against Children 2019 to 2023 was launched just last week by the State Department of Social Protection, and this was quite timely. And this document will be able to address issues related to violence against children, including the strengthening of different support services, of particular launching and setting forth a toll-free reporting line, offering psychosocial support and counseling that is available, and of course the use of 1190 as a toll-free line to be able to report any case of violence or abuse. We would like, of course, to appreciate the efforts of partners who've made this possible in terms of ensuring that our vulnerable members of the community are protected. And we continue to really ask each and every one of us to be duty-bound when it comes to protecting these members of our communities. On the part of the ministry, we have provided guidelines for healthcare workers to be able to offer trauma services for the injured patients, including victims of violence during this COVID-19 pandemic. Recent studies have shown that victims of violence are often unwilling to go to health facilities, especially because they may fear contracting of COVID-19. And so we want to continue to assure Kenyans that our health facilities are well prepared to provide services to victims of violence, while at the same time ensuring that one is protected from being infected with COVID-19. We continue to urge our healthcare workers to be sympathetic to victims of violence, including gender-based violence, by ensuring that they manage both the physical and emotional and mental trauma that these victims often experience. And on the other hand, it is important to note that while we may be ready at the facility level, while our healthcare workers may be ready, it becomes important to ensure that we use the approach of prevention is better than cure when it comes to violence. And so again, activating our community health structures, activating the Ngao structures, activating our communities, our churches, to ensure that we really do step in to be able to protect the vulnerable in our communities. Turning on to the COVID-19 situation, today the news is not any better. Today is the day that we have actually recorded the highest number of positive cases since this pandemic struck. Out of the 6,754 samples tested in the last 24 hours, we have 796 people having tested positive for this disease. And this brings the total number of positive cases in the country to 15,601, pushing our cumulative sample size so far tested to 200,061,027. From these cases, we have 3 foreigners, we have 503 males, 293 females. The youngest is 1-year-old infant, while the oldest is 87. And I feel it becomes important to emphasize today, while we do have the 796 cases reported today, 89% of them are asymptomatic. And that's important to note. 89% of them are asymptomatic. Again, leading to the emphasis that we've placed that this disease is really well within our communities. Again, to place the emphasis that, any one of us could actually be afflicted with this COVID-19 disease. In terms of distribution by cases, by county, Nairobi has the highest at 539, with a positivity rate of almost 13%. Kiambu 63, Machakos 57, Kajiado 37, Migori 26, Kericho 15, Narok 11, Uasin Gishu 11, Laikipia 9, Nakuru 7, Busia 6, Mombasa 4, Kisii 3, Murang'a 2, and Siaya 2. Embu, Kisumu, Nyeri, and Trans Nzoia all have 1 case each. We have provided a distribution in terms of sub-counties, but to provide highlights in terms of Nairobi, Kibra continues to lead with 64 cases, Dagoretti North with 55, and Embakasi East with 40. In terms of Kiambu, we have Ruiru leading with 17 cases and 9 in Thika. In Machakos, 50 of them, the cases come from Athi River. In Kajiado, we have Kajiado East having 23 cases. In Migori, we have Kuria West having 19 cases. And in Kericho, we have Ainamoi having 14 cases. Narok West leads with 6. Whereas in Laikipia, we have Laikipia West leading with 6. In Busia, we have Teso South leading with 3. And in Mombasa, Mvita leads with 3. Kisii, all the 3 cases are from Kitutu Chache South, whereas Embu, Kisumu, Nyeri, and Trans Nzoia all have 1 case each. The good news is that 378 patients have recovered from the disease. Out of this number, 199 are from the home-based care program, while 179 are from various hospitals, bringing the total number of recoveries to 7,135. And we continue to salute our healthcare workers for this commendable work that has enabled us to achieve these results. Sadly, we've lost 3 patients from the disease, bringing our total fatality to 263. And in aggregate form, we stand at around 1.7 case fatality in the country. We do want to pass our sincere condolences to the families and friends of those who've lost their loved ones. And finally, we would like to make a special appeal to you Kenyans to ensure that when you do feel unwell, that you visit the healthcare facility immediately. In the past few days, we've received several reports, reports shared with us online, calls of patients who perhaps are afraid to now seek care. And we are witnessing cases where people are rushing to hospital at the last minute. and then of course succumbing to the condition because we've not been able to intervene at an appropriate time. So we do request you really to seek care should you feel unwell, to be able to approach the health facility because it is detrimental if you come in late. Thank you. Questions?
Hi, my name is Graham Kajilo from The Standard. My first question is on how the government, how in control would you say the government is in terms of controlling the spread of the disease? Is there a time that it will reach and we say the government has been overwhelmed? And my second question is about the issue of positive cases among healthcare workers. It's an issue that has already been raised by the World Health Organization. We'd like an update on how many health workers have tested positive and how many hospitals have been affected, and also confirming the issue with the spinal injury facility, where we are informed that about 20 healthcare workers have tested positive. And on that issue, will it reach a point, how will that issue of healthcare workers affect services?
Thank you. My name is Purity Muse from KBC. Kindly requesting for an update on the impact that COVID-19 has had on maternal and neonatal care in terms of women visiting hospitals for antenatal clinics and also immunization for their children. From the cases of COVID-19 that we've had, I do understand that children have not very strong immunity. So how many children have tested positive for COVID-19? How many have succumbed to this disease and how many have recovered from it? And lastly, a special request, kindly if you would try and keep time with these briefings. If it's been difficult for you people to keep time, if for example you could be calling us at 4 p.m. or 4:30, we would come, but not 3 and then the briefing starts at 4 or 4:30.
Thank you. My name is Enoch Sikole from Citizen TV. First question. According to the announcement by the CS for Transport, that is Macharia, James Macharia, we expect that the first foreign flights to come into the country will begin on the 1st of August. So the question is, how are you looking at the people who will be coming in? Will they require to be quarantined for 14 days? Or what is the protocol there? Will they, or once they show a valid COVID-19 certificate, then they will be allowed into the country? Another question is from our sister station, Radio Citizen. They've done some research on the dump site, that is Dandora dump site, and they have found that face masks are ending up in the dump site, and they are asking whether that poses danger to dump site workers. There's so many people who go there to eke a living. So what does that mean for the people who work in the dump site? And is there something that you can do to ensure that probably some of these face masks that could be hazardous could end up or should not end up in the dump site? My last question probably, it's about the issue of communication. Doing rounds, we found out that either Kenyans are rebellious or some of them are just ignorant about the effects of this disease, and that boils down to the communication by the government. There is a feeling that most or the approach by the government is more town-centered or city-centered. It's not touching the people. Because when you remember about HIV and AIDS, how you are tackling HIV and AIDS, there was a change that in approach that targeted behavioral change. But now people say that they are not seeing that much. It's more about announcing figures rather than going to the people and just touching their hearts on why they need to take care.
Perhaps let's take that first set of questions, and I'll start with, Graham's question. He asks, are we in control, and at what point will the government say it is overwhelmed? What I can say here is that yes, right now, in terms of the triggers we put in place, in terms of our signals, our alert system. We're very much in control of this situation. It's important to actually reflect and see countries who've gone before us, the Italies, the Spains, and perhaps here in Africa, South Africa. You can see that we're dealing with a public health emergency of huge proportions. And so it takes a lot to be able to say, you've reached the point of being overwhelmed, and I really do not think and I do not envision a point at which we would ever be overwhelmed. We are well seized of the issues. We are putting in place all the interventions, and this is collaboratively with county governments. And so, no, we are not at that point. But do we have a signal? Do we have an alert system that tells us that perhaps here we need to, refocus our energies and resources? Yes, yes, we do. And so we are observing and surveying the situation as it evolves. In terms of our positivity, you've asked how many healthcare workers have tested positive. The numbers, continue to increase. Today, I think I'll ask Dr. Kuria to expound on that, but I'm aware we're at about 500 plus healthcare workers who've tested positive. And yes, at Spinal Injury Hospital, there were cases that were found of positive healthcare workers. However, I'm also aware at Spinal Hospital, certain reconfigurations in terms of their rosters and how they manage patients has been put underway. So service delivery will not be affected. Now, the question is, should this continue? Should these numbers continue to increase? Right now, we are standing at about 3.6% of positivity in our healthcare workers. So out of all the people who've tested positive in the country, about 3.6% are healthcare workers. What happens if this number jumps to 10%? Of course, that would be grave. Of course, that would have implications on service delivery. However, again, we continue to protect our healthcare workers to ensure that they're safe, to ensure that they have the gear that they need, to also ensure that at the end of the day, also you, mwananchi, can get the healthcare services. Have we made contingency plans for that situation where perhaps we may have a huge inundated number of healthcare workers affected? Yes. Of course, we are working on that to see how do we reprogram our service delivery? How do we ensure our health system would not be, overwhelmed? How do we ensure continuity of health services for all other essential health services? There's a fantastic group of technical experts who are working on this to ensure at the end of the day, even with supposedly increasing numbers of healthcare workers, because that is bound to happen, that you can access your diabetic clinic, that you can access your hypertensive clinic, that you can still get immunization services for your children, you can still go to an ANC clinic if you're a pregnant mother. Enoch has asked a question regarding the incoming flights from 1st of August. Again, this is an issue we've expounded on in previous briefings. In fact, the Cabinet Secretary has spoken to this issue. It's an issue that's still under review with clear determination to be made as we get to August. Remember, our modeling teams have shared with us various scenarios. And one of the ones that was actually being discussed this morning is the peak of August to September and what that would look like. And so with such considerations, with such implications on the ground, this becomes an issue that we should discuss and engage with when that time comes in. That being said, I do remember the Cabinet Secretary did state that yes, of course, issues of quarantine would need to be taken into account of to ensure that we are reducing on any importation of cases within the country. There's an issue of Dandora dump site and face masks. In fact, you don't have to go too far. Right there at Uhuru Park, there's a lot of face masks on the grass. So, of course, it becomes a big issue in terms of how we are managing our waste. One, the responsibility is not only for those who may manage waste management in terms of NEMA, in terms of regulation. It's you and I, because that face mask got there from a certain nose and mouth that it was covering, right? And so there's an element of responsibility when it comes to how you're able to discard this. I will ask Dr. Kefa, who is here and who has really long dealt with the issues of waste management, to share with you what we foresee in terms of being able to manage this waste, and also in terms of hazards. Remember, we always say, in terms of the studies and the evidence that has come forth, that COVID-19 virus is able to last onto surfaces for an inordinate number of days. Some people say from 16 hours to 72 hours. And so it means, of course, there's a risk. If you're working in a dump site, of course, there's a risk in terms of you coming into contact with that mask. But remember, that same dump site also has many other risks. COVID is a new disease, but there are many other diseases that you can actually contract in terms of occupational health when you're working in a dump site. And so, of course, it's an issue that we need to discuss, an issue that we need to provide communication, health education to. So what does it mean when you're working there? How do you protect yourself as you try to clear the dump site? And I think Kefa will expound on this. There's an issue that has been brought on by Purity regarding what is the impact of COVID-19 on services. Again, we've actually just recently concluded the first draft of our assessment of continuity of essential health services. And once that draft is finalized and ratified at the senior level, we'll be able to share it with you. But preliminary results from that draft indicate that in the month of March, all the way to April, May, there's actually a significant dipping in terms of attendances to hospitals. I did see the report, and it noted that we had almost 30% decline in outpatient visits. So in every 1 year, if you're having about, say, 1 million Kenyans visiting a hospital because they're unwell, it means about 30% of them in the times of COVID, the early phase of COVID, decided not to visit a health facility or were afraid to visit a health facility or could not get to a health facility. And of course, that has ramifications when it comes to the health of the nation. We've seen a decline in immunization services, particularly DPT-3, which is an indicator for immunization. We saw about a 20% drop of that. We've seen a decline in deliveries, but again with good news. In the month of May, and like I said, this report will be released soon, we've seen almost a normalization. So the curve went down drastically, but in the month of May, there's a resurgence to near normalization for deliveries and for immunization. We saw very minimal change in antenatal clinics. Again, a curious picture. You know, mothers still attended antenatal clinics more or less. But of significance, when it comes to chronic care condition clinics, HIV, TB, arthritis clinics, gynecology clinics, we actually saw a drastic reduction, nearly almost 40%. And what that means is that our diabetics were not going for their refills to the clinics. What that means is that if our HIV patients were not getting their medication, what that means is that our TB patients were not getting their medication. And so that's a problem, and we have the team. It's worked on guidelines, how to ensure there's continuity of care. It's working to see how we can actually create that confidence back in being able to access a health facility and get the care that you need. Thank you, Purity. We will endeavor to ensure we keep time, and we take note of that inconvenience, and we do apologize for it. With regards to communication, the last question before I hand over to Dr. Kuria, indeed, we've had your cries, we've had a lot of feedback from the publics with regards to our communication. We have a very savvy team that looks at all the social media posts. We've seen all the memes about today we have dash cases of which dash recovered, of which dash died. We've seen all that, and we appreciate the council to be able to actually rejig and reform our communication strategy. And so what we've done, today we actually do have new communication officers standing here. So we've recruited new team members who will be working on this. We've revamped our health promotion unit. Health promotion officers have actually developed what is known as a Bcc strategy. And I'm glad the person who asked this question was talking about behavior change and communication. So the very strategy that was adopted during the days of HIV/AIDS is what now we are going to adopt. You're going to see a lot of engagement with the community. You're going to see a lot of people visiting marketplaces, a lot of people visiting supermarkets, workplaces, to really engage with the public and to try and define for them and, make them understand exactly what is going on. I think you've seen the Cabinet Secretary ensure that he's doing county visits. And those have been instrumental. I can tell you, having participated in a few of them, when you head down to the counties, they do appreciate, and Mwananchi does sort of get that realization of why there's need to be able to mask and wash your hands. We have a large number of people now in the field looking, seeing, trying to see how we'll better adapt this BCC approach. So we've heard your call, and this is something that we are now actioning. I think at this point, I'll invite Dr. Kuria to come in and answer on the questions regarding our healthcare workers testing positive and other technical aspects. Karibu, Daktari.
Thank you. Yes, Marcel. To the issue of how many healthcare workers do we have infected so far. To note here is that as a number of cases in the country continue rising, and today recording our highest figure of 789. This figure also includes a number of healthcare workers. So as the CS continues saying, I can get it, you can get it, healthcare workers have not been exempt from this. And considering that they all live with us, healthcare workers are part of this community. So there is this notion that maybe they are getting infected out of the handling of the patients. That may be true. There have been cries of inadequacy of PPEs, but we must be cognizant of the fact that these healthcare workers are also living with us. And the idea of them, the possibility of them contracting this disease also from us is also live. So yes, we have over 500, as Marcel said, and the number have continued to recover. But what we have actively right now is that we are following up on about 500 of them. They are in a number of facilities, some in ICUS, and a number just have mild symptoms. So that's a figure, and almost over 70 facilities have now reported cases, at least one case each in their facilities. So it is not affecting any specific facility, but any, and that is why we advised that each and every health facility, even small clinics in town and in the informal sectors, they need to prepare themselves and have PPE ready, because you never know when a COVID suspect or a likely case of COVID is going to appear on your door, and you must be ready to handle that case. So healthcare workers continue getting infected is a concern to us, and we continue urging our healthcare workers to continue employing the use of PPEs judiciously and properly. And of note especially is when they go into areas of the rest areas. That is where sometimes caution is thrown off the wind, and we urge them that at all times, we talk about BCC, we extend our BCC also to our healthcare workers, that even in those rest areas, whoever you are sitting next to could still be a case. So we urge them to continue using their PPEs, and especially the face mask at all times. The message, and we keep saying this, it is the use of the face mask at all times that is going to save the common mwananchi and the healthcare worker. So we talk about the number, but the message here is the continued use of the face mask at all times is very important to all of us. Thank you.
Dr. Kefa.
Thank you, Waziri. On the issues raised about the waste arising from the usage of masks, was it an issue that we were foreseeing? Yes, we were foreseeing that. What have we done? We have actually come out with protocols, guidelines on the same, generally on management of waste. And this goes beyond urban and rural, because, and it has come handy in the issues of home-based care. We are aware that in the home-based care, there will be quite a huge churning of used masks. So what have we advised? We are not advising, we are actually looking for appropriate means of disposing the waste. At the very rural presentation, in our protocol, which is actually in the main waste management and also in the home-based care, we are advising that the best disposal point would be a pit latrine. Just have it in a container, dispose it in a pit. You will not give it a chance to anybody to use. But in the urban situation, this waste is supposed to be disposed in such a way that there is no way out a second party would be able to access the mask. Now, we are all aware, this common information that all of us have been able to have, that the virus can stay in some places for some time. Not to forget other contaminants, which can also be having a chance of actually going into the mask. So in the masks, the used mask and all other wastes that are arising from those who are suspect should be disposed following the protocol or the guidance that have been provided by the ministry. And these are supposed to be used in the national government and county government, including individuals. And please pass over this information that it will be counterproductive for anybody to use a mask that he doesn't know who used it. Thank you.
I think that concludes today's session. Thank you.
You save by not having to use multiple products. And you only rinse once. For a laundry soap that can help save you time, water, and money,